Hey Tony, hey Steven, how are you guys? Not much. Not much. It's getting dark very fast actually. As you can see, it's pitch dark outside. Just sitting with Duke. Oh, where is Duke? He just jumped off the bed. Let's see if we can see him come in. I hope you guys are doing good. Looking forward to learning about heart disease. Sounds good. We'll get started here shortly, but if you have any questions, Steven, go for it. Ask away. Duke, enough water, bud. Usually I don't put in much water. About a quarter of a cup every time. Greeting from India. Sunil, how are you? Good evening from Miami. Cheers. Here comes big boy. There he is. There's a big boy. Did you have a little nap? Come here. 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 Yes. You relax a bit, bud? Good evening. What a great day to live in. Oh, cheers to that, Ziggy. 100%. 100% it is. I hope you guys are having a couple good drinks. Hopefully we'll see a lot of changes. A lot of changes will happen, hopefully. A lot of good changes. Doing good, thank you. Excited about JFK as well. Oh, 100%. I think he's going to bring in a lot of things to the table, which is amazing. And you've probably seen my post that I put out this morning. Duke, come here. Come and say hi. Come and say hi to everyone. Leave the wood alone. We're splitting wood, me and Duke, all day today. Because it wasn't that cold. So we can keep the wood stove nice and hot. A lovely rose wine, here of 5. Cheers. Thank you, Leona. No, you're not going outside, Duke. Stay here, bud. It's too dark. And I know what you're going to do. You're going to go bark. Yeah, I'm trying to actually configure that wood stove because either it gets really, really hot or really cold. So I'm trying to actually find like a medium happy. I'm trying not to, and the thing is, if I put like 3 logs in there, like half the logs almost, they last about 6 hours, but the damn place gets like almost 30 degrees. And I like it to be about 17 degrees to actually sleep good. Okay, don't be long. Don't be long. No! Hey! No barking at night. Where's my little seat? How much can heart disease be reversed? Does one have to go 100% vegetarian to achieve a reversal? Vegetarian is bullshit. Who told you that you need to go vegetarian to actually reverse your heart disease? That's unheard of. That's totally incorrect information. Totally incorrect information. 25 degrees Celsius here in India. Oh, it's like 1 degrees outside. So it's pretty cold here actually. It's pretty cold. It's about 1 degree. It dropped yesterday to -1, -2. But it's about 1 degree right now, so it's not bad. I wanted to drop into like the freezing temperature before I leave, go back to the city. So I find out if my water is gonna end up freezing or not, because it took me a lot of time to actually dig about 4 feet and put the water line. So we'll see what happens. So hopefully my whatever I did working so far. We got hit with a heat wave in Massachusetts. Oh wow. So it gets really hot, which is nice, not bad, as long as it's not too extreme. Dean Ornish. What about Dean Ornish? Guys, I'll put this out one way or the other. Heart disease is reversible, has nothing to do by being vegan or eating a vegetarian diet or nothing like that. That's all nonsense. And whoever you guys read about, Dean Ornish or other Steven, seriously, trust me on this, has nothing to do with being vegan or vegetarian. Because what happens is, going vegan, you're not consuming, let's say, fat intake to actually increase your cholesterol. It just buys you time till you fix the root cause. It's the same thing as you taking statin till you fix the root cause. But vegetarian is not gonna fix the root cause. Vegans are not gonna fix the root cause. If anything, you're gonna actually become more deficient, and you're gonna lose a lot of energy to supply to your body and give it the raw material to actually heal itself. The cause of heart disease is two main ingredients: vitamin D and magnesium. Very simple. Fix that up, fix your arteries, you'll be fine. Nasser, hey, how are you? Waiting my Cavadex order. It's been approximately 2 weeks. Getting anxious that my order have been gotten lost in the shuffle. Looking forward to starting treatment. Don't worry, Rachel. Sorry, Raphael. Sorry. It will come in time. If it does get stuck on customs, just follow it, send us a message, or send the company a message. They'll actually look into it for you. But usually there is a slight delay, but nothing to worry about. Everybody's been getting their orders. Just gotta keep my eye on Duke. Hello everyone. Hey Latro, how are you? Will vitamin D and magnesium heal triple A? What do you mean heal triple A? Gal, thanks so much for the flower. You must have a lot of friends with the good advice you have. Hello, Latro. Abdominal aortic aneurysm. What about it? Where's Duke? I can't see him. Oh, he's just sitting outside on the balcony. It's freaking pitch black. You can't even see anything. The lining of our arteries does have vitamin D receptors. For a triple A, it's exercise caused by inactivity. Vitamin D and magnesium heal triple A. It does. And you would actually add nitrate supplements to kind of activate your nitric oxide levels as well too. It's better to proceed with surgery. I would not. You weren't born with it. You need more of blood flow to actually start helping with the repair. My dad had heart disease. He lived behind the desk, pale as can be. I never got heart disease. Physically active outdoors. But like I said, guys, most important two vitamins, Duke, is vitamin D and magnesium. Very, very simple. Let me get Duke. Obviously, he sees something. Hey. Come up here. Cayenne pepper in moderation helps clear plaque from the arteries. It increases blood flow, but it doesn't mean that it can actually help with the healing. There's no such proof that it actually helps with the healing. It does actually thin out the blood, so it actually prevents, let's say, any damages and stuff, but it's not going to actually help heal. There's no proven evidence behind it. It's more of a carrier more than anything. I read an article that says DGL regulates cortisol levels too. Can notice it too. Oh, you're still on it, DGL? That's awesome. Yeah, it does a lot of good things. I know I've only used it and mentioned it in regards to the gut, but there's a whole bunch of different benefits as well too that it offers. Where's Duke? I can't see him. It's too dark. Sorry guys, just trying to find him, see where he's at. And Minnesota has the lowest rates from heart disease. Hawaii is second, and Colorado is third. They are all physically active outdoors. Well, keep in mind, being active is one thing, because keep in mind it activates nitric oxide, but being outdoors as well, you're getting plenty of vitamin D as well too. And without vitamin D, you won't be able to synthesize correctly your magnesium, and they're both needed. Gotta be somewhere. Where is he? So you guys just gotta check on what causes blood pressure to drop. Your potassium and magnesium are being regulated. Too regulated. Duke, go up from the stairs. You can't come up from here. Come up. He will. He's just too busy right now. At night he sees things that I can't even see. I have to go outside with a flashlight. Because yesterday at night we had one coyote come by. Best potassium to take, I would never take a potassium. It's better to get it from food. The heart disease maps follow the smoking maps, poverty maps, and diabetes maps. Yes and no. Yes and no. Think of it this way. Every single issue, whether you're smoking, whether you're diabetic, whether any type of disease that we're actually looking forward towards, let's say heart disease, they all come down to one single ingredient: magnesium loss. As simple as that. Once your magnesium is lost, that's when heart disease comes. When you smoke, you lose magnesium. When you don't eat correctly, you lose magnesium. When you don't drink the proper hydrated water, you lose magnesium. All these things play a huge role in a magnesium loss. And that's why they say, when you hit the age of 40, for example, you start to lose your nitric oxide production. Well, guess what? Magnesium regulates your nitric oxide production. And it takes that long to actually develop. Some actually get developed very, very young in age by losing nitric oxide. It is because we end up overutilizing magnesium and we never actually fulfilled that fulfilled it sufficiently enough. Best form of magnesium, the only one that we actually get from food or our water, is magnesium ionic chloride. It has the highest levels of elemental, and our bodies can actually digest and absorb up to 65%. All the other magnesium forms out there, they're all man-made, and they only have anywhere between 5 to 12% absorption rate. No matter what, every patient that I had for the past 18 to 20 years that actually I came across that actually have existing, that had already existing heart attack or falls in the heart disease category, they're all straight out deficient in magnesium and vitamin D3. As simple as that. And we were always looking, and you know, I get a lot of individuals, they tell me, well, my magnesium is good and my vitamin D is good. You guys do incorrect testing. And the doctors has no clue about it because they all do an incorrect testing. Your total cholesterol 243. There's nothing wrong with 243. That's normal for your age. There's no need to worry about it. Keep in mind your brain, your cognition, your heart, your hormones, your pretty much your best antioxidant is all require, they all require cholesterol. So Neil, it's called magnesium ionic chloride. Arnold, 100%. And we need a steady supply of magnesium. Without magnesium, pretty much, you know, your mitochondria will not function. Your nitric oxide won't be produced. Can actually fall short. And that's why a lot of people end up having a lot of issues at a very young age, because we're actually overusing it. And guess what? You know, anything that you consume, processed, overcooking, mixing too many ingredients, that all destroys your magnesium levels. My D3 was down to 12.6, now 89. Thank you, M. Cheers to that. Yeah. Make sure you're at least 80 nanograms per milliliter, which is actually excellent. Where is he? Duke, stay around here, bud. Be nice. Why are some of the questions you're answering not showing up in the chat? Oh, Amy, I have 2 lives going right now. I have one on TikTok and one on YouTube. So there's a lot of questions being displayed on TikTok non-stop. So that's why you guys don't see them there. I can only kind of give an answer. We have a free clinic for you in Baton Rouge, Louisiana. I gotta go visit there and stay there. That'd be awesome. Maybe I should start doing this. Maybe I'll stay in Canada in the summertime, and when a winter time hits, I can go to Louisiana if the weather is better than here, because it's getting pretty freaking cold. I would love to show you guys the mountains already. There's some snow on the mountains. Maybe I'll do a live during the daytime so you can see how much snow we have. But it hasn't snowed here yet, so I know it's gonna come soon. I'm just enjoying the wood stove too much. Can you repeat the best magnesium for heart disease? Magnesium ionic chloride. I have the bottle displayed on my website, guys. Check it out, please, and you can see how I use it. What do you think or know about L-tyrosine? What would you like to know about L-tyrosine? It's good for your brain, good for your heart. Helps you relax and takes out that jitter brain away. John, hey, it's been a long time. Been on steak diet and no more digestion issues. Steak and veggies all are the cure. Cheers to that. I hope you're enjoying the meal. So you're becoming like me, just steak. I only eat steak and eggs. You're including the veggies, go for it. Once in a while I do include arugula, only if I can actually grow it. Just because it gives me enough nitrate to vasodilate the arteries. What do you recommend for GI broom? GI broom, I haven't heard of that. Ooh, I'm running behind on some stuff. I'll have to look into it. Maurice, hey bud, hey, what's going on? Does N-oxide help blood circulation? Nitrate, yes. It does vasodilate and increase blood circulation. D-ribose gives me racing heart less than 3 grams daily. Technically, if you're not it depends on the situation area. You should not really exceed 2.5 grams per dose. Can AFib be resolved? Yes. Best supplement source for vitamin D. And I do have an ebook on my website. Definitely download it and check it out, please. This is for TB. Best supplement source of vitamin D. Make sure your vitamin D is mixed with MCT oil as a carrier. Have not stopped coughing for 3 months. Can't sleep at night. Lots of phlegm. Wa'il, are you taking NAC and acetylcysteine? Give up gluten 3 months ago. Gave up gluten 3 months ago. Lost 12 pounds. Initially holding steady now at 197 pounds. A1C was 6 prior. Trying to eat clean, no processed foods. 58 years old. 58 years young, sorry. But have 40% calcifications in the lead. Yeah, all that stuff you can actually fix it. And you already ordered the Cavadix, which is excellent. You just have to kind of, fine tune the lifestyle a bit. You'll be doing great for yourself. Best supplement post brain surgery, non-cancerous. Has to be high fat intake, eggs, salmon, avocado, all that good fatty acid to support the brain. L-theanine, L-tyrosine to actually help relax the nerves. Would magnesium be good for the AFib? 100%. I did an ebook on AFib, so definitely download and check it out, and I'll teach you how to saturate correctly with magnesium. I feel heavy on the right side of upper tummy. What could that be? That's your liver mostly. A nutritionist told me not to supplement with D3 because blood level is 81. Been taking K2 100 microgram daily alone to avoid calcium deposits. 80 nanograms per milliliter, that's your optimal level. I don't know what the hell these nutritionists are talking about. They're clueless. And you're not taking enough vitamin K2, by the way. You need minimum about 300 micrograms. If you're taking 100 microgram a day, that's not nearly enough. And you have to take it with last meal of the day. The fattiest meal. Maurice, a few weeks ago, I was overwhelmed with fatigue. You stopped using what? How can we connect? Kathy, if you click on my picture profile on the top left, it'll actually take you to my website. On the website, you can actually book an appointment and we can actually talk one-on-one and I can help you with any issues you have. Let me know if you can find it, Kathy. Duke is back. He's on the bed. Can you guys see him? There he is. There's Mr. Duke. He's looking. Good afternoon, Maurice. Hey, Dave, how are you? What about magnesium L3 That's man-made. Very informative. Cheers. Thank you, Suno. Maurice, don't forget about the protocol for me. Oh, I already finished half of it, Ziggy. No worry, I haven't forgotten yet. I already finished half of it. I should actually... I have 3 appointments tomorrow, so once I'm done the 3 appointments, I can finish up the rest of the protocol for you. No worries. Should vitamin K2 be taken with D3 or separately? Should be consumed together to actually regulate and synthesize your calcium levels, but do take them at night like I do. Like I take, you guys want to know what I take for vitamin K2? I take 500 micrograms daily at night, and I take 50,000 IU of vitamin D3. Do you know anything about vascular Ehlers Danlos? I'll have to look into it, Dave. I'll have to look into it. I haven't heard of that term before. 340 triglyceride and 0.92 for HDL. Is that bad? You're getting too much storage. You're eating too much carbohydrates, possibly. Way too much. Should vitamin K2? I've answered that. I wish I can set the phone somewhere so you guys can see me better. Especially the product he has on the site. I have bought and used it a lot of them. Thanks, Marie. Do you believe in stents? What's stents? Are you talking about stents? Should vitamin K2 be taken with D3? We've answered that one. What should I do with heavy of the right upper belly? Start taking some digestive enzymes. Do some fasting. Do I believe in stent? It's not whether I believe in stent or not, but sometimes that's the only option you have if your artery is becoming blocked and you're not able to actually get proper blood flow. What else can you do? You can't do anything other than put in a stent to actually open it, because you can actually fast. But how long can you fast to actually prevent any further damage? You can take vasodilation, and you can do peptides. You can do a lot of different supplementation. But the problem is, sometimes if it's an emergency crisis, you have to do it. But if you still have at least a 10% gap, let's say you're 90% blockaged. I had one patient, he was at 90%, and we start doing a protocol, like a heavy duty protocol, and he got it done, and he didn't actually go with the stent anymore. So there's a possibility. It depends on your body. It depends how your body adapts to things. I've had 5 stent. It has helped me so much. They do help. They do help, because it becomes to a point where your arteries are clogged up, over 90%, 80%. If it's 80%, I'd rather wait, because I know we can actually reverse that. But when it hits 90 plus, it becomes tough. I am foot soaking right now in magnesium sulfate. Perfect. That's the way to do it. That's the way to do it, 100%. Magnesium sulfate is one of my favorites. Duke. Is fasting harmful for women? It's not whether it's harmful. You have to do it correctly. And don't overdo it so you actually throw your hormones off balance. Is vitamin D3, K2 good? Yes, it is. It depends on the dose you take. Never take them like as a one pill. Take them separately, because every person requires a different level of vitamin D3. Duke has been a good boy. This is Duke's bed now. He sleeps here. I sleep in a tiny house now. A user 007. What magnesium do you suggest? I have the link for the magnesium on the website, guys. It is a blue bottle. It says on it Aussie Trace Minerals. Duke went to town today. Did you go to town today? Remember? We walked. You met two dogs. One is a husky. I don't know what was the other one. It's a mix. Have a blessed day, Jay. Thank you. I've been told that vitamin D3 calcificarol can be poisonous and is rat poison. It is used for rat poison, but we're talking they use millions of international units. Compared to us, a human, we barely take under 10,000 or 20,000 IU a day. So don't even compare it. Seriously, I did a video about that. You have to go in the millions to actually cause toxic effect. And keep in mind, when they do it for rats, they do like a very, very high dose per kilograms. So it's not nearly enough to actually hurt us. They still both actually made from calcificarol from the sheep skin or something like that. I've been taking Kyolic aged garlic for a year now. Angina seems to be going away 100%. To actually speed it up, add some D-ribose. I'm having an angiogram. He will stent at 70%. Can you reverse it? Less than 80? Yes, you should be able. You could be able to reverse it. We have a supplement for it. Now, it can take probably a couple months, because keep in mind, the calcified artery contains 4 different categories. You got oxidized lipids, you got calcium phosphate as hydroxyapatite, you got fibrin, collagen, and debris. So we can definitely go after that and reverse it. Ehlers-Danlos is a collagen disease, banding inflammation in the connective tissue. Apparently no cure. I'll have to look into that. I haven't heard of that before, Dave, but I'm going to check it out. Send me a direct message if you don't mind. I'll look into it. Maybe make a video on it. What is that, please? What do you mean, what is that, please? Go off statin, taking Zetia now at 10 milligrams. Still want to find something better to lower triglyceride? Take niacin. For reversing, yeah, you can reverse. Book a time with me. We can talk about it. There's a protocol you have to follow. It's not something that just happens overnight. It took years to develop your calcification up to 80%, and it can take sometimes few weeks to few months to probably start to reduce it. What digestive enzymes do you suggest for the liver? I have the link on my profile bio under Enzymatica. How much niacin? Start with 500 milligrams. There you go. Get your little love, little boy. Yes. Yes. Today, Duke actually had almost 3 pounds of chicken. He's a big boy. He wanted to eat today so much because he played so much. He burned all that energy, right, Duke? That's why you're not giving me a hard time today? I want a consult with you. I ate so healthy for years, not sure why this issue came up. I can help you 100%. Yeah, book a time with me, DX398. We can talk about it. We can walk through over the process and a protocol and everything for you. No worries. How to book a time with you? If you click on my picture profile, you're gonna see my web page, guys. Once you click on the web page, you can click under my calendar and book a time. If you can't find it, send me a direct DM, please. Is having a calcium score test best way to find the plaque? That will only find your calcification, but it does not find if you have soft plaque. You have to get what is called the CCTA scan. So this way you can find both calcifications and soft plaque. And there is some blood tests we can do that we can actually see whether you have inflammation in your arteries or not as well. Okay, I'll leave you alone. CCTA scan, yeah, CCTA scan. It's computographic 3D imaging of your heart. They actually show you. Every patient of mine has it. It'll show you the calcifications, but it'll show you whether you have soft plaque or not. Adjusting the stupid wood stove is tough. If I put it to the lowest, the wood does not last very long. It dies off because there isn't much airflow coming in. And if I keep it in the center, it gets so freaking hot. Right now it's about 20 degrees, 22 degrees. Guys, I'm gonna make some mushroom coffee. It's time to have my mushroom coffee. And I'll stick with you guys for another half hour because I have to do a couple things for a few patients. So we're gonna have this mushroom coffee. It has about 6 mushrooms in there and a little bit of caffeine. Actually, I don't know, for some reason he's not supposed to take this at night. You get about 5,000 milligrams of caffeine per serving. Not 5,000 caffeine, sorry, mushrooms. Supposed to take it during daytime, but I take it at night. For some reason, it helps me sleep better. I actually go into deep sleep. What labs do you use for testing? It depends. You have to go locally. Oh, you like it at night too, Jade? That's awesome. You have to go locally and do the blood test. I can tell you the names of the blood of the biomarkers. You just have to go locally and get them done. I should have heated the water right on my wood stove. It's okay. TTFD or benfotiamine. So the benfotiamine, it is synthetic because it is a fat soluble. I probably go with the regular thiamine. What is the best way to contact you to become one of your patients? If you click on my picture profile, you're gonna take you to the main TikTok web page. There's a website there. If you click and you book a time, then you'll actually automatically become one of my patients, and we can actually have a full profile open and everything on you, and we can actually discuss everything in details. And I'm gonna put some MCT oil. That's roughly about a spoon. Anything to reverse stage 4 CKD? Yes. NMN, 500 milligrams. TMG, trimethylglycine, 1000 milligrams. Take them every single morning as soon as you wake up. That will increase from stage 4 to probably stage 3 or 2 within about 90 days. Give me a second, guys. Gotta put some water. Just gotta heat up the water. Anyone else think this was Rick from Walking Dead? I get that a lot. Can you please repeat? What did I just say to repeat? Oh, for the CKD stuff, for the kidney disease, stage 4, NMN, nicotinamide monocleotide, 500 milligrams, TMG, 1000 milligrams, stands for trimethylglycine. I have both of them on my website. One comes from Australia, generic Australia, and the other one, and you get 20% off actually if you order it from there. And the other one, you can get it from iHerb. Not getting through on website. So the website is stan.store/my name, Maurice Daher. Let me see if I can type it in. Comment. So stan.store /my name. There we go. That's my website there. Pin this comment. I've been on blood pressure for years. Any chance I can get off it? Easily. I did an ebook on how to actually come off high blood pressure medications and reverse it. Check it out, Chris. I just started Cavadix. Can I take nattokinase with it, or what do you recommend to take with it, my brother? Yeah, you can do nattokinase anywhere between 12,000 to 18,000 FU. You can take serapeptase up to 500,000 SPU. You can take vitamin K2, 500 to 1,000 micrograms daily. You can do the full stack if you want. You can do your EDTA as a chelation therapy. You can do the full stack, or you can just do most of it. Thank you for everything you do for us. You are a true blessing. God bless you, my brother. Thanks so much, Manny. Thanks so much for the comment. Maurice, we celebrate a birthday here last week also. Miss Blaine's birthday is November 1st. Oh, cheers to that. Well, happy belated birthday. Cheers to that. Scorpion. That's awesome. November 1st, November 1st. I don't know how old I am now. I think like 28 or 26, something like that. What was it? I think I got stuck on 28. Clear up occasional AFib recommended blood test. RBC magnesium, not serum. Best supplement for testosterone. If you have infrared light, shoot the infrared light on your man part 6 minutes every other day. How can I contact with you? If you click on my picture profile, Crave, it's gonna take you to my main page on TikTok. There's a website there. Click on the website and book a time. If you guys can't find that information, please send me a direct message. 25 years old, remember? Oh yeah, that's right, Jay. 25 years old, Blaine. Cheers to that. Taking ashwagandha, D3, magnesium, MK7, TMG doesn't seem to influence my blood pressure. Why would it? You're probably not taking a good enough dose, Chris. And you're sometimes, ashwagandha will actually overstimulate your adrenals, so that's why your blood pressure never stables. I highly recommend Maurice. He truly wants to help us heal. Helps so much. Thank you, Marie, for your kind words. You are ignoring me. I'm not ignoring you. Maybe your message has been blocked, possibly. Re-enter your question. I'll see if I see it. I try to read every single question, unless I'm missing some. I cannot talk about Lyme here. Last time I got banned for a couple hours. Diverticulitis. Start with digestive enzymes and hydrochloric acid. That's your first option. Keep in mind, guys, the food you consume You're either eating to feed a disease or you're eating to heal one. So sometimes you guys ask me questions and I tell you, well, you have to kind of do this or do that or change certain food from your diet, and you argue with me, tell me this food is good, but yet you still have a disease. So don't you ever kind of wonder why? Blaine, Maggie, do you have a dog? Maggie, do you have a dog? What do you recommend for eyes? Astaxanthin, zeaxanthin, and taurine. These are a perfect stack for your eyes. Let me mix my mushroom coffee really quick. I've been waiting for it. Is hawthorn good as tincture? It depends on the extraction. So check with the company, find out the extraction level. Make sure it does have the 1.8% Vitax in it as well too. If it doesn't, then it's not gonna really do a whole lot. So check and make sure it's not mixed with like a glycerin or anything like that. Because sometimes they do mix it with glycerin and stuff. It's better to be mixed with alcohol. How do you reverse heart disease? Oh, there's a lot of different... I'll give you only one answer, magnesium. And I'll give you the second answer Crave gave you. Food is medicine. What are the best anti-cancer supplement? Maggie, do you have a dog? Oh yeah, you do have two. And you probably use deworming, is that correct? So if you use deworming, that's your answer. Is there magnesium pill version? No, and even if there isn't, it's not gonna be the correct one. It's gonna be man-made. Maurice, if I eat pizza and highly processed crap food, what supplement do I take to be healthy? Digestive enzymes before, hydrochloric acid after, fasting for 18 hours, take digestive enzymes on an empty stomach to get rid of any waste. Carnivore diet is good for fulfill any missing nutrients. It's the only diet out there that will actually fulfill missing gaps without causing any coagulation effect. Maggie, you're saying the answer. So deworming, anti-cancer supplement. How do you lower blood pressure? Download my ebook on how to reverse high blood pressure. It's very easily fixed. I have an aortic aneurysm and was 4.5 centimeter when diagnosed. Before I went carnivore 4 months ago, my latest echocardiogram measured the aneurysm is still the same size, 4.45. Will carnivore steady this? Well, you've only been on carnivore 4 years, 4 months. You know, it took years to develop the aneurysm, and you think just by going on a carnivore that's just gonna fix the issue instantly? It's gonna take time to actually fulfill the missing gaps, and sometimes certain supplementation has to be added to actually help with the process. So guys, you have to keep in mind, it doesn't mean once you switch to carnivore automatically within 3, 4 months or 5 months is gonna fix things. Things took years to develop. Sometimes it's gonna take years to actually reverse, but you will start to feel better, and with certain supplementation you can actually help speed up the process. Remag ionic magnesium chloride as good as Aussie. The Remag ionic magnesium is not bad. The only downfall about it that I don't like it does not have the rest of the trace minerals in it, so you can actually absorb as much magnesium as possible into your body. But the Remag is usually, it's always been my second option, but it doesn't have all the trace minerals in it, same as Aussie. I knew of this, but I had no idea it is good. But if you suggest it, I have more trust. I use it. I use it all the time. I use ivermectin just to kind of give you an idea. especially if you're thinking you're gonna get sick or anything. I use vitamin B17 as well. What do you think of magnesium oxide? It's probably one of the worst magnesium you can actually ever put in your body. All it is good for your diarrhea. Nothing more, nothing less. And it's man-made still. Strauss hard drops. Yeah, what's wrong with Strauss hard drops? I know the company very well, and I've used their product. And the company, I've met the original creator for Strauss hard drops. They actually have, if you buy the Strauss hard drops and you don't drop your MPO level or your LPPLA2, such as your PLAC biomarker down within 90 days, they're willing to give you the money back. That's how much they believe in the product. It's a mixture of garlic and hawthorn and a few other herbs in there as well too. And you put it under your tongue for best absorption. I've used it for 4 years, by the way. It is a Canadian company. I don't know if you're in the US or Canada. Not cheap of a product. I am in Canada. You can definitely do a consultation if you go to my main webpage and you can book a time. We can definitely go there. Zinc picolinate would be my favorite. What are you drinking? Mushroom coffee. I am in Canada. Yes, you're in Canada as well. If you are in Canada and you want to try the Strauss hard drops, maybe we can go on an order half-half because... Oh, you are in Toronto? Okay. Maybe we can go on an order half-half if you want. Maggie, lungs nodules, I think maybe not so good after 3 years. I hate CT scan. Start doing some NAC, heavy forms of NAC and heavy forms of taurine. Why do some people get a bad reaction to lion's mane, like mental illness, heavy metals? I don't know. So I've tried like almost 6 different companies. Every company I tried, I actually had bad reactions with lion's manes and others. This is the only one that I actually find has been working out for me good. Hey Sean, what's going on? Have you installed the fresh air intake hose to your stove? I have. I actually had. There's no parts here, unfortunately, Blaine. So I had to actually come up with my own method, and I'm trying to actually. I put the stove to the lowest form, so not much air going through, so it doesn't get too hot because it's becoming like 25 degrees here, and it's really brutal. Let me show you. This is what I did. It's a 4-inch hole, and it's just kind of going inside, but I haven't kind of set it up inside, so there is some airflow coming through that. I hope that's enough, and I've been testing it for 2 days now. It's not bad actually. It works really good, but it's freaking hot. Like right now it's about 25 degrees, and I have it at the lowest level almost. So I just have the air tank going in, and it just flows air up inside of it. Like there's no real. I called the company. There's no real package for it. There's no real kit or nothing. So he's like, well, you can buy the kit. The kit's like $200, and it takes 2 months to arrive here. So I just went and picked up the heating materials and kind of put them together. And actually, it worked out not bad. But the damn room gets like super hot. In here, it's about 19 degrees in the trailer here in the bedroom. And in a tiny house is like 25 to 27 degrees. Are you in what? Are you in toilet? Any advice for healing kidneys from microscopic damage? Did you get everything finished so you can stay there through the winter? I got most of it done. I'm not gonna stay here for the winter because I'm gonna go to the city to visit the family for Christmas. But I'm gonna push it here all the way to like December to get to a freezing point and see if my water lines or anything like that freezes. And yesterday and today, all I've been doing is splitting wood. Hi, I'm D. Thank you. Thanks for your advice. My son, he's now on a healing path. Blessing. No worries, James. I'm glad everything's working out. We'll definitely need to chat because we were supposed to chat that day. You never called me. Best way to lower cortisol, take some L-theanine. 5 stents at 44. Put on Prolulant plus all the other meds. No cholesterol is not good. Okay, book a time with me. Let's talk about Zeems. I can help you. Do you always take taurine with your magnesium? I do, yes. As much as possible. Where is Duke? Is going to be in December. Duke is gonna be in Calgary with me. He never leaves my site. So while I'm in Calgary, Dahlia, I know you're in Calgary too. We're gonna definitely have a little visit so you can meet Duke. 4 or 5 dashes of cayenne pepper and water give so much cardiac relief. 100%, especially under the tongue. Make sure it's at least 90,000 heat units. Could a temporary carnivore diet improve my liver? What is temporary? And anytime you have a liver issue, keep in mind the liver can take up to 3 years to actually reverse. It doesn't mean if you just go temporary it's gonna help. You're probably not gonna have any symptoms, but it's not gonna fix the issue. Long time no see. Hey, how are you? It hasn't been that long. I'm trying to finish some stuff and split some wood. Look at all the wood I have outside. I don't know if you guys can see them. Right on the deck. Yes, but you said you go overseas. No, I don't go overseas. I go to Calgary to visit my parents and my brother and my nieces and my nephews. I have the magnesium taurate 1000 milligrams and taurine 500 milligrams. What's the difference? They're both the same. One has magnesium elemental plus taurine. They call it magnesium taurate. And taurine by itself is just taurine. But they both have taurine in it. They just give it a different name. It's like, you know how they do like magnesium glycinate. Well, all it is just magnesium elemental plus glycine. Magnesium taurate. Magnesium elemental plus taurine. Magnesium citrate. It's the same thing as magnesium elemental plus citric acid. So everything has, you know, they actually changed the name to confuse people. Any recommendation for anxiety and depression? Yeah, download my ebook, Dave. I did an ebook on anxiety and depression and what supplement to stack with. Stack for vivid dreams. What was the stack? Zinc, L-theanine, vitamin B6, creatine. There was something else as well too, and I forgot for the vivid dreams. How much L-theanine a day? You can take as much as you want. There's no side effect. Oh shoot, I got the right stuff. Then I was a bit concerned about the high dose of magnesium. The only reason if you end up taking too much, you're gonna have a slight soft stool effect, but you should be fine. Many buy some organic cayenne pepper and add it to water. It has to be organic. If it's not organic, it's one of the highest sprayed crop out there for cayenne. But the problem is people not getting the right one. They have to be at least 90,000 heat units for it to work correctly. If you're getting like 20,000, 30,000, 40,000, you're gonna take so much of it. Mugwort for vivid dreams. I have to look into that. Are you Lebanese, Greek? Yes, you got it correct. Is it true zinc is good to help you sleep? Yes, 100%. I take about 30 milligrams at night, especially if you want to get that vivid dreams. But I want to try that one that this person mentioned. Mugwort. Shilajit is bullshit. I don't know. That's my point of view. I tried like 6 different companies, not cheap either, but didn't feel anything. Maybe because I'm too healthy. I don't know. 90K, wow, never seen that. Yeah, you need at least 90K. I've seen 145,000K, but 90K minimum. Actually, if you want to use it for anything to do with heart or thinning blood or anything like that. But you can't really take too much cayenne because it could cause, what do you call it, hemorrhoids. So you gotta be careful. My friend is still in the hospital from his stroke, going to rehab for his right side. When he gets better, now his wife is also in the same hospital, running tests on her. I don't know why yet. That's interesting. Okay, hopefully he's feeling good. How come he hasn't recovered yet? That's taking a little bit longer than usual. Can you repeat what is wrong with normal cayenne pepper? First of all, it has to be organic. Second of all, they're too low of heat units. What's NMN used for? Well, NMN is technically is for anti-aging. But keep in mind, why do you think we actually get older and stuff? Because we lose energy, and NMN is only the product out there that can actually produce natural energy by boosting your mitochondria. How much cardio do you recommend weekly? I don't know, 2-3 times a week, doing HIIT about 20-25 minutes max would be ideal. He can't move his right arm or leg. So did they give him the anti-clot needle? They put it into his arteries and stuff, and it's an anti-clot buster to actually allow for movement, unless it happened in the brain. My chest feels like it's always vibrating. It's your pancreas. Hi, did you say the K2 MK7 D2 brand you like? Yeah, I put the product on my website. I was responding to a lot of the comments. So what I did is I put the product that I've been using on the website. So go under supplements and gear off my website. You should be able to see the vitamin K2 MK7 that I currently use. 9D for life. Thanks, Maurice. His problem was blood pressure, and his stroke was from a bleed, not a clot. Oh, okay. But I'm surprised he's not able to move his right side still, if it's not a clot. What stack can I take for atrial fibrillation? Go download my ebook, please, about how to fix atrial fibrillation. And you're gonna support my channel as well too. Is a thyroid TSH of 6 low? What is considered? I don't really talk much about TSH. I talk more about the T4 and the T3. They're more relevant than a TSH on its own. My 6-year-old has a lot of phlegm cough. Give him some NAC. NAC is gonna help with that. 600 milligrams every 4 hours. Does hawthorn react with medication like blood thinners? It doesn't, because it doesn't really thin out the blood, so I can't really see it conflicting. Hello, any supplements to lower bad cholesterol? Yes, you can download my ebook on how to lower cholesterol, but there's no such thing as good or bad cholesterol. That doesn't exist. You know, the couple years ago, back in the early 1980s, roughly, give or take, some doctors in white coats sat together on a table and said, hey, how can we get everybody to take statins? So they thought, well, we can call one cholesterol, which is HDL, the good cholesterol, and we can call LDL the bad cholesterol because it's constantly high. And this way we can feed everybody statins. So there's no such thing as bad cholesterol, guys. Yeah, you can do the benfotiamine with NAC for breathing issues. You can add vitamin A as retinol as well too. I like nitric oxide as well because it vasodilates all your arterial system as well. But benfotiamine works good. Or if you don't want the synthetic version, you don't want the one you mentioned, you can take, what is it called, thiamine as well too. Naturally increased testosterone, 48 years old. What if you're estrogen dominant? Why don't you work on your estrogen levels first, and your testosterone will go up naturally? And usually if you're gonna do benfotiamine, Blaine, I usually like to go at least 200 to 300 milligrams per dose. What about blood pressure pills and hawthorn? Do those react? No, they should not. They should not react. Even thought, hawthorn does activate your nitric oxide production for vasodilation, but should not react. What is apple cider vinegar used for? Increases acidity in your gut. So this way there's no food being left. Any recommendation for a progressive multiple sclerosis? Send me a message. I'll send you some information on that. I use Biocytical D3K2 spray. I haven't really. Is that a good brand? Deficiency of 22. I don't know. I'll have to look at the product. But if you're that deficient, you definitely need to actually increase it 1500 IU per 25 pound of body weight for your vitamin D. Can I take Cavadex, Thought, and IV? It doesn't exist as IV therapy. It only exists as enema. What about liquid magnesium spread typically on the skin for absorption? You could, but your body only absorbs very, very small amount externally. Have you tried trauma release? It's amazing. Trauma release. No, send me the link for it. Let me check it out. I'm 110 kilograms. I take 5,000 milligrams per day. No, you don't take 5,000 milligrams. You take 5,000 IU. 5,000 milligrams, that'd be like in the millions of international units. Justin is nervous after the US election. We need to get rid of Justin, which is Trump is going to help us Canadians soon. 110 kilograms, 5,000 IUs. That's not enough, I don't think. Type on YouTube, 3 supplements can be useless if your nervous system is fried from trauma. For menopause, please. What about for menopause, please? Send me a message. Type TRE David Bersili. Okay, I'll look into that. 600 milligrams of NAC. How many? 5 days on, 3 days off. Thank you for all this great info. I will be scheduling a call with you and encourage everyone else to do the same to support the channel. Thanks so much, DX398. You're very, very kind of you. Looking definitely forward for our conversation. Justina is going to get Latina. Oh, 100%. 100%. What can be used for polycythemia vera? I read several articles saying that LDL levels of 50 or lower rate recommended for people with heart disease. This sounds crazy. Imagine, I look at for LDL at minimum 200 milliliter per deciliter, milligram per deciliter. And yet, people are saying it should be below 50. So imagine, your brain is going to be fried. Your heart muscle is going to actually struggle. Your hormones are going to be out of place, and you're constantly going to have like a foggy brain reaction. Having 50 or less of LDL, that's insane. Seriously, that is insane. Are there benefits to drinking tea? If you actually add MCT with it, some type of fats, you can actually absorb the polyphenols. Where is Luke? He's right behind me, he's sleeping on the floor. I don't want to say his name. Every time I say his name, he'll actually get up. Valerian root is really good. Actually, I take it once in a while as well too, to actually help me go into deep sleep. How much fenbendazole to take? You have to download my cheat book, Maggie, and I'll actually tell you how much you're supposed to take within the exact routine. Are you familiar with arrhythmia nodosum? What can get rid of it? I have an arrhythmia nodosum. I have to check into it. Tell me a bit about it, Alisa. Is medical assistant made ethical in people that are suffering with mental illness? Is medical assistant ethical in people that are suffering with medical illness? I don't know if I can answer that. I don't know if I should answer that. What form of potassium is most bioavailable? Get it from food, don't take it as a supplement. What kind of services do you offer on one-on-one formulation, stack formulation? Pretty much whatever you want. Well, you want a protocol, you want to discuss something in specific, you have a lot of questions, want answers, I'll do the whole thing. Taurine causes me bradycardia, HR56, taking beta blocker, cardiol, and high blood pressure. Taurine should never really interfere with your heart. It's just a medication you're taking that are just conflicting. Do we really need 4,500 milligrams of potassium daily? I doubt it. I've been on a carnivore diet for 10 years. I probably consume maybe, I don't know, 1,000, 2,000 milligrams of probably potassium that I get from food. Is MCT in green tea good too? Yes, you just have to blend them. Cheat Sheet 2 is gonna hopefully soon. I'm working on it as a web-based. It's taking me a little bit longer time than usual because I still have to. I thought it would actually transfer all the data, like the old data from the PDF to the web-based, but it's not gonna do that. So I have to punch it in all manually. It's good to take lysine. You could take lysine. It does help with the collagen production. Low stomach acid, possibly SIBO. Yeah, you can take hydrochloric acid, digestive enzymes, apple cider vinegar. There's a lot of things. You can balance your sodium to potassium levels. All that stuff will actually fix your digestion. I get tired fast when working out. Not enough mitochondria support. You're struggling. Sauna good? Sauna is okay, but too much of it can actually get rid of a lot of your organic and non-organic materials. I got 10% left, guys, on my phone. Stack for severe brain inflammation. L-tyrosine, L-theanine, MCT oil, cod liver oil, hesperidin. When approximately will you be in Calgary? I'm not sure, but it's going to be sometimes in December. And I'll probably be there, December, January, February at least. How to improve mitochondria and lengthen telomeres? You get NMN, you get creatine, D-ribose, magnesium. Would you advise to go see a cardiologist? What for? What the hell is a cardiologist gonna do? Because you're tired? You just need to boost up your mitochondria. You can do a CCTA scan to see if you have any issues with your blood flow or calcification. High pH, low pH water, any benefits? Is there such thing, high pH, low pH water? I didn't even know. Or is it just some influencers trying to tell you, hey, this is high pH, this is low pH, you should be drinking it? I haven't really checked into that. I just drink directly from my creek water here. How do you, high or low, any benefits? I haven't, to be honest with you, haven't really looked into it, Blaine. I'll look into it. Send me a message if you don't mind. An email. I'll actually look into it to see if there's an actual benefit from high or low. Never really thought about it much. Do you sell creatine? So many kinds of. I do not sell creatine, but I do have one on the website for the one I use. A lot of people in the chat are saying they are tired. They are tired. Low iron can make you tired if the anemic state. That's very rare that you'll have low iron. How to help a blood flow? Whenever you're tired, it's always think of the food you're consuming. You are actually either eating food to cause a disease or you're eating food to actually heal. So if you're constantly tired, why don't you never question your food? CCTA scan will tell you if you have good cardiac perfusion, yes, and it tells you whether you actually have calcifications or soft plaque. Is mushroom coffee better for your health? I like it. It's not whether it's better for your health or not. I like it just because it does have all these 6 mushrooms in it and it kind of helps me relax. Some bottled water leans more acidic, some more alkaline. I think the acidic is more coming from being stored in plastic more than anything and the way it's processed. I think water is water as long as it has enough minerals to be hydrated correctly, and what we call it is easy water. Once the sun hits your water, it becomes more of an easy water where the body can actually utilize it correctly. What would you recommend to eat daily for cardiovascular health? Stick to a carnivore diet. Stick to a single ingredient. Is it recommended to take K2 MK7 with D3 along with a breakfast of eggs and bacon? I take it at night. What do you think about vegetarian diet for cardiac health? I think it's bullshit. That's my point of view. I think it's bullshit. Do beets really help increase nitric oxide? How many times a week should I consume as part of diet? Beets are a waste of money and time. You have to consume 300 grams worth of beets every day to activate your nitric oxide production. It's not how many times a week, it's how many times a day. So it's not really worth it. What is good for cardiac brain, or what do you think is lacking in the body? Vitamin B1 or L-carnitine? Would a blood work be enough, or do I need a blood work? Could be okay. It will just tell us what inflammation you have, but it does not actually target specific arterial system. How can diabetics consume electrolytes without spice? Why would there be a spike unless their electrolytes actually have sugars infused with it? Beside Nero, any source of K2, make sure it comes with mixed with MCT oil possibly, if you could. But taking juice beet is good to detox liver. No, it's full of sugars. It doesn't really detoxify the liver. What test would you like to see for a consultation? Send me a message because it depends on your situation. Is insulin a root cause of many health problems? I don't know if I would say insulin itself. Insulin can actually make things grow and it can actually heal things. It's not the insulin that actually is the issue. It's our mouth that we don't stop from over consuming certain things and we tip the scale. We tip the scale of sugars, for example, and that's where insulin becomes an issue. How to detox from mercury? It takes about 30 some years to detox from mercury. The only one that is proven to actually work fast is zeolite. But I don't know how fast it could work. You actually have to do like a hair analysis. Should Nero be taken on an empty stomach? It should be consumed with food. It does need fat soluble to actually be absorbed correctly. Unless you got a specific form where you can actually use it on its own to actually eat away fibrin. Then you can take it on an empty stomach. Maltodextrin cake, I would never use that stuff. I had all mercury fillings removed 30 years ago. I can still feel a tingle when I'm touching my face. Keep in mind, mercury can take 30 years to be flushed from the system. So one of the best things you can do is get a hair analysis to see whether your body is still excreting out mercury or not. Doesn't the body detox itself? Only if you give it the right nutrients. Anything for snoring? You have arterial issue with snoring. It's mostly your breathing that actually is your blood flow. Increase the oxygen and your snoring will go away. Anything fulvic acid to remove mercury? It works okay, not the best. Can supplementing with neurokinase and K2 be redundant? Well, they're two different things. K2 kind of goes after your calcium to regulate your calcium. Neurokinase goes after like your fibrin, clotting issues. What can you do for fungus in your sinuses? NAC. I had a protocol for fungus. I'm trying to remember. Everyone should get a cone beam dental x-ray to check for hidden chronic infections that cause inflammation. Should get a cone beam dental. That's pretty interesting. I'll have to look into that. X-ray to check for hidden chronic infections that cause inflammation. I don't know if you heard that bright side smile from Emma from YouTube. I got DX398. He said you should get maybe a cone beam dental x-ray. How to reduce uric acid naturally? Cherry tart, celery seeds. What is your take on palo azul, also known as kidney wood? I haven't heard of it. I have to actually look into it. Is pure monk fruit a safe sweetener? It is, yes. Monk fruit is good and allulose is good. Search dental cavitation surgery. Trying to reduce sugar. What is your take? Will elevating legs against wall help with blood flow to the heart? Think of your calves as your secondary heart. So that's why it's ideal to move and it's ideal to actually work out your calves. But yeah, it does a little bit. What are good food to take to improve blood circulation for the whole body? Nitrate, arugula would be like your top, garlic, onions, ginger. All that stuff will actually increase because they all actually have or contain nitrate, and nitrate will actually activate your nitric oxide pathway. Root canals and wisdom tooth removals sometimes get infected and go unnoticed for years. That's interesting. It's probably, and a lot of people actually probably have issues. Keep in mind, the teeth are actually connected with our whole system. Beets are overrated because they contain way too much sugar, and they're actually, if they extract the nitrate correctly, they work, but if they don't, it's not really an ideal source. B complex, if it is one of the cofactors for the energy. Drastic reduction in carbs and increased fat has melted the pounds off me, down 20-25 pounds after 7 months of carnivore. I'm not as strict as I should be. Imagine if you were strict. That's pretty awesome still. 20-25 pounds is still pretty amazing. Blaine, keep it up. You're doing great. Carnivore is the way to go. I don't think I'll ever change. Been on it 10 years now and I'll never change. Do you know much about SIBO? What would you like to know, Jessica? I'll take one more question and that's it, guys. Because I'm gonna get going. I have to wake up early morning tomorrow. And I gotta finish my cheat book. Because every day I've been putting in a couple hours, putting some stuff in for. I wish I can just have somebody do it all at once. Good night, Doc. Thanks. Cargo, Snipper, cheers. Hawthorne, beneficial for arterial health. 100%, Ray. I did a video on Hawthorne. Go watch it, please. Thank you for your information. Do you eat any fruits and veggies on carnivore? The only thing that I eat is, I only had 1 cup of berries this year. Pretty much whatever I can grow myself, yes. I don't buy anything from the store. I don't trust anything from the store either. Either I grow it myself. This year, I've only got 1 cup of berries, and I did grow my own cucumbers and a little bit of arugula. That's about it. But I don't buy anything else from the stores. I think they're all bullshit. BC girl, thank you for sharing your thoughts and knowledge. Hey, I'm in BC too. Okay, thank you. I don't trust store either. We should never. What age should you start taking NMN? I think as early as 30s, to be honest with you. Especially because due to the environment we live in, we start to actually lose our nitric oxide and energy molecule at such a young age. That's crazy. Can CHF reversible? Cool, I'm 39. I'll get into that. So many NMN products out there, they say IV drip is best. IV drip because due to the cell exposure, but the thing is, I've been taking NMN directly from Australia. That's the one I currently take, and it works amazing. And I'll never really switch. This is my 6th company I've tested, and it's the only one that actually works really, really well and very, very effective. Either whether you take the IV drip or you take the NMN capsule, either way is gonna still take about 1 week for the NAD plus to be actually active. Chilajit, I've tried Chilajit. I still have some, really expensive, and I didn't feel a difference. Maybe because the diet I utilize carnivore diet. Maybe that's why I don't feel anything from it. But all it is just some fulvic acid and trace minerals, supposed to actually enhance certain things. Didn't really feel a difference. What is the brand name? The one I use is by here. Let me show you guys the one I use. It is the Australian brand, the one I have on my website, and the company is giving us 20% discounts as well. So this is the one I use. So the Genetic Labs, it is on the website. This is the NMN I use. So I take 2 capsules every morning. So I take about 500 milligrams of it. Congestive heart failure is reversible. Yes, 100% it is reversible. Okay, guys, I'm gonna get going because my phone is almost dead. Show the bottle again, please. It is on the website as well too. So this is it. It is a glass. Genetic Labs. Can you see that, Jade? What is NMN? It's mostly used for anti-aging. It's supposed to actually activate your proper mitochondria. Keep in mind, every cell in your body requires energy to function. Every cell in the body requires energy to heal. So if you're trying to heal anything in your body without activating your NAD plus or taking NMN, you're never going to be able to heal it. Whatever other supplements you take, that has to be actually included into your arsenal to actually support your body in healing itself. So almost think of it as your battery cell that activates all your mitochondria so they can start to function correctly. And if you guys gonna order some, don't forget to use the 20% discount that I have. There is no real need for CRP to be done on a continuous basis. The only reason sometimes we do it on a 3-month basis in the beginning, just to kind of see or find out, is the food that you are currently consuming, is it causing any type of inflammation reaction? And if it is, it's going to show on the HSCRP blood test. If it's not, that means the food or the source of that food is legit, is clean. Kidney stones, magnesium citrate. Okay, guys, that's about it. You guys have a nice evening. Just join. NMN stands for nicotinamide mononucleotide. 6 months since my lab test. I would get one, Blaine. I would get one. I would get your LPPLA2, would get maybe MPO, get your HSCRP. Just kind of like a broad things of to kind of make sure, you know, the diet you're following, your body's capable of absorbing, there's no issues with the pancreas, no issues with anything else. And you can actually go from there. And definitely would be good to kind of keep record of it. Thank you. God bless you. I hope we can chat more about CHF. We will, Candy, 100%. Why do I get sleepy after my first meal of the day? Because you're probably spiking your insulin. Good night. Thank you for your knowledge. Cheers. You guys have a nice evening. Steven, I don't know what the hell you're eating that's actually putting you to sleep, but whatever you're consuming is actually spiking your insulin, and that's what's actually putting you to sleep. That's the only reason. So something you're consuming that's actually activating your insulin, and you're getting a drop. Once you get a drop, you're gonna start to yawn and feel tired, and you want to go to sleep. Guys, I do have to get going. You guys have a nice evening. I'm glad that a lot of you guys in the USA are happy. And if you guys are happy, us in Canada, we're gonna be happy as well too, because now we can maybe kick one of our guys out, and hopefully we can get somebody elected that is good. So in the meantime, you guys take care, enjoy the rest of the evening, and stay warm. And some of you, stop eating that Captain Crunch with crunch berries. Yeah, no kidding. Please, brother, what can I take to get rid of kidney stones? When will you be on again? I'll come back again tomorrow, guys. Seriously. If I finish everything during the daytime, I'll come back again tomorrow. I usually like to come, I usually come every single night, but I haven't because I've been tired from splitting so much wood. It's actually a really good workout. Don't get me wrong, but I have to do so much. Eggs, yes or no? I'll give you one example. DX398. I eat anywhere between 12 to probably 20 eggs a day. So eggs, 100% yes. There's nothing wrong with them. They are delicious. They're full of good essential fatty acid. They're a powerhouse for your heart. But do me a favor. Don't overcook the yolk. Keep it as raw as possible so you don't oxidize any of the essential fatty acids and the fat and the vitamins in it. So 100% enjoy it as much as you could. If I could actually, you know, next year, I'm gonna actually have my chickens. So if I can get like 20 eggs a day, I'll be eating 20 eggs a day, seriously. I'll be eating 20 eggs a day. I've done that 4 years ago. I did eat 24 eggs every day for 3 weeks and was just incredible. The brain, like Jade was saying, the way you feel, the energy, the strength, it's amazing, seriously. The benefit of it is just incredible. And stop being worried too much what the doctor tells you that it's bad or high in cholesterol. It's not. They're just, you know, they're just teasing you to kind of feed you more medications. Please, brother, tell me what can I need to get rid of kidney stones. Magnesium citrate and Shanka piedra for your kidney stones. I have 38 chickens. Lol. Where are you at? I need to get some eggs. You're probably so far away from me. I'm in like the lower mainland of BC. But next year we're gonna have me and my neighbor, we're actually gonna have some chicken, and it'll be, I think, a good start. Oh, you're on Okanagan. You're about 4 hours away from me. 3-4 hours away from me. Maybe I'll buy some chicken from you for next year, next summer. Guys, I got like 5% left before my phone dies. We'll come and visit you in Okanagan, me and Duke. We'll come and say hi. I will have babies by spring. Perfect. Save me some. I'll buy like 10 chickens from you. Or 10 little babies from you. So this way I can save them for me. Save me 10, seriously. I'll drive. Me and Duke will drive, and I think you're about 3.5 or 4 hours away from me, and we'll get the chicken from you. We'll say hi, and we'll head back, and I'll make sure my neighbor has the whole cage and the whole setup ready to go. It'll be amazing. Touch base with me. Send me a direct message if you don't mind, and we'll touch base, and we'll definitely do that. It would be awesome. Guys, I do have to get going. You guys have a nice evening. Stay warm, and I'll definitely try to come back tomorrow. In the meantime, you guys take care of yourself. Cheers.